I answer the next question, which is, can I walk y'all through a typical day in my life as a child psychiatrist? As you can probably imagine, the day in the life of a psychiatrist is going to differ depending on what setting you're working in. Currently, I work in an emergency room. I come in the morning. Typically, the workday starts at 9, and we start with pre-rounding. Essentially means talking and discussing about the patients that we have in our observation unit. Essentially run through the list, talking about any outstanding things that need to be done, any overnight events, these rounds. Nursing is on the call, social work is on the call, psychology is on the call. We can all be on the same page about how we're going to plan the day. After we do that, we typically do our walking round. So that's when we actually go and do our assessment and evaluation for the patient, do our follow-up, and make any sort of planning. If they're on observation status, do we think that they actually need to have a full admission to an inpatient unit? Do we feel like the patient could be discharged actually? Do we think that they would benefit from maybe a family session before discharge? Part of the day is dealing with the patients that we already have in our observation unit, making any of the follow-up phone calls, making connections to their outpatient team, setting up appointments, setting up any plans for whenever they are discharged. If they're going to be admitted, then that's the time that we're talking to the inpatient team. That's how we pretty much spend the day when it comes to our patients that we already have with us. The other way we spend our day is anticipating whoever's going to come in to the emergency room during the day. When a new patient comes, you'll do the whole evaluation. So that involves speaking with the child, speaking with their parent, information from people who know the child the best from school. Maybe they have an outpatient team already. Maybe they have a therapist, they have a counselor, have a psychiatrist already. So you would try to get information from them. Sometimes we have kids who are coming in from different entities. So they're not necessarily with their parents, like children's services, group home, or residential treatment. So we'll talk to the staff members who brought them in. I spend the rest of the day writing notes. I'm also teaching. That's typically my shift. It's just filled with a lot of clinical work and some education stuff as well.